Hi, it's Dr. Camille Kraus. I'm a naturopathic doctor with Conceive Health, working out of Kitchener-Waterloo. So I wanted to talk about the question that came up is, do we switch sides when we alternate? And I actually didn't know the answer to this because the common assumption is that we do, and a lot of animal species actually do work that way. However, in humans, it is completely random which side we ovulate from. I looked into this partially because I had a patient who had both ovaries but had lost one tube to an ectopic pregnancy. So there were certain months where, with the fertility clinic, they were monitoring her, but she was going to ovulate on the side that didn't have a fallopian tube. And so instead of doing an IUI, then they just did timed intercourse at home. There's still an off chance. There have been reports of the other sided tube swooping over and picking up that egg. Very rare, but we always have that hope. And so I was kind of looking into it to see whether that was true, whether we did switch sides or not. And so I found some really interesting papers that I wanted to share with you. A lot of studies have been done on fertile women who have no problems conceiving, and then also on couples who are going through treatment to conceive. And so both of them seem to say it's random and it's 50-50. It's like a coin flip, or, what gender is your baby going to be? It's 50-50 every time. However, there was a super interesting paper about 1,000 cycles that were monitored and 270 women. And they looked at, whether you're switching sides or not, but not just that part was random, but whether the side that you ovulated on changed your chances of conception. And the answer was yes. So this is the wild part that I wanted to share with you. So they were looking at women going through both IUI and IVF. And they were measuring everything from the oocyte retrieval rate, fertilization rate, embryo development rate, pregnancy rate, implantation rate, and live birth rate. Mostly that's for IVF, but then for IUI, they were looking at pregnancies and live birth outcomes. And what they found for both IVF and IUI, the highest chances of conception were when the ovulation happened or when the egg retrieval happened on the right ovary. They have no idea why that's the case, why the right was different than the left. But here's what they found. It wasn't just the right-sided ovary that seemed to produce higher chances of pregnancy and live birth rate outcomes. It was when it was the right ovary that ovulated after it was the left ovary the previous cycle. So we call that contralateral ovulation. So it switched sides. And then when it was the contralateral right was the highest success rates. And I'll give you some numbers in a second, but the poorest outcomes were actually when it was the ipsilateral left-sided ovulation. So left 1 month, left the second month, those were the poorest numbers. The thinking was that, so even if it was ipsilateral right, so right-sided ovulation 1 month, right-sided the next month, didn't have as good of numbers as left-sided then right side, like switching sides and then ending up on the right. They don't really know why. The thinking was that the corpus luteum from the previous month was kind of taking up space and squishing the development of the next follicle coming up the following month. That was one idea that they had, and then it just changed kind of the hormone profiles as well. So no super clear explanation, but here are some of the numbers for you. So this is the pregnancy rate for IUIs. When it was contralateral right, meaning left ovulation, then right ovulation, the pregnancy rate was 15%. And when it was ipsilateral left, so left-sided, then left-sided again, the pregnancy rate was 7%. And that's a significant, clinically significant difference. And then the pregnancy rate for IVF was somewhat similar. So contralateral right, when it switched sides and then the treatment was done on the right, 13% pregnancy rate. And ipsilateral left was 3%. Again, that's significant. This is pretty meaningless to you while you're at home, but when treatments resume, and if, you have a certain amount of finances, or this is your kind of one shot, and you're being monitored by the clinic, they can tell which side you're ovulating on. So to that degree, you do have some power to say, you're looking for that left-sided ovulation, then right-sided ovulation, and boom, that's go time. So the only other thing you would need to know from home is that some women do experience the mid-cycle ovulatory cramping or twinge or pain or tenderness on a certain side that they can kind of tell. It's a little bit more rare. Not everyone feels that or can tell that, and there's no other way to tell which side you ovulate from. There's absolutely no way to tell. But if you can feel that, then that's just another piece of data that could be interesting for you to record or note or take heart by. Interesting, eh?